I don't see how we're going to be able to deal with the onslaught of patients that we're seeing now without having to get some external help.
ICU doctors plead to Manitoba's government that now is the time to act, calling for military support as Manitoba ICUs fill to capacity yet again. Dr. Candice Olofsson has a master's in public health and is an ICU physician who granted City News an interview while on call in the hospital. Olofsson is one of the many doctors who signed a letter calling for government action as staff manning the ICU reach a breaking point.
They're broken. They are so discouraged, tired, and without a clear plan or end in sight, we're losing staff in droves.
The letter calls for military aid in ICUs, not only to deal with staffing shortages, but to allow redeployed staff to return to their jobs and ultimately begin chipping away at issues like surgical backlogs.
We would be failing in our duty as advocates for the public if we did not speak up at this stage. We are not prepared. The ability to increase ICU by another 20%, the beds are there, but the human resources are not there.
Dr. Eric Jacobson, another ICU physician and signatory on the letter, says today's ICU numbers are around 40 for COVID patients, with the other beds filled with general ICU patients. The doctors say we've been near 100% capacity for a week now, and we're on track to be sending patients out of province for care yet again. They're calling for an increase to enforcement of public health orders and entirely new restrictions for gatherings this holiday season.
Close to 100% of those patients are unvaccinated patients with COVID. So really in the realm of medicine with a preventable disease.
We cannot afford to have a large holiday spike. Our hospital system and our healthcare cannot accommodate a large COVID outbreak. And so that's why we're calling for increased restrictions.
Manitoba's opposition party says the time to act is now.
The request for help from the military needs to come from the Premier's office. And if those physicians on the front lines are saying that we need this assistance now, then those at the political level who are overseeing the healthcare system have to take action immediately.
The Premier needs to make the right decision and call for help. She has to do it. The lives of Manitobans depend on it, and that is the leadership that we're calling on her to display immediately.
We reached out at the Premier's office and received a statement from a spokesperson for Manitoba Health and Seniors Care that reads, in part, our government requested health human resource assistance from the federal government to provide 15 to 30 ICU nurses for an approximate 6-week duration. This request was made over the weekend, and we are awaiting response from the federal government. The doctors say getting to this point in our fourth wave was predictable, but appropriate preventative action was not taken. Now is the time for out-of-the-box thinking. In Winnipeg, Mike Albanese, City News.